Hello, everyone. Hope you're doing well today. So, what I'd like to do is go over the wearing on her nerves case study looking at multiple sclerosis. So, what I'd like to do is take the back camera and turn things around here so we can run through this. All right. So, going through some of the background, it reads Kathy, a 20-year-old woman, awakens one morning to a tingling, numb sensation covering both of her feet. This has happened to her a number of times throughout the year. In the past, when experiencing this sensation, within a couple of days to a week, the numbness would subside, and she is not too concerned. Uh, about a week later, she notices that the numbness and tingling not only persists, but also spread up to her knees. Again, she ignores the abnormal sensation. By the end of a month's time, the numbness spreads to the midline of her body. At this point, she becomes alarmed. Kathy sees the nurse at her college, who tells her that she should see a doctor. Kathy calls her doctor's office to schedule an appointment, but the soonest slot is in 2 weeks. She makes the appointment and goes about her daily routine. The next morning, Kathy wakes, but when she attempts to get out of bed, she comes crashing to the floor. Because she is still groggy from sleep, she doesn't really understand what has just happened. As she tries to stand up, the muscles in her left leg engage, but as she also attempts pushing up with her right leg, she falls again to the floor. She sits in bewilderment as she tries to make sense of what has just happened and realizes that she has seriously scraped her knee in her fall. She does not feel the pain from her wound. So, all sorts of signs here. Kathy thinks about how odd this year has been. She remembers another medical issue she had earlier in the year when she had lost hearing in her right ear and wonders if there is a connection to her current condition. At that time, Kathy underwent extensive testing, but to the ear, nose, and throat specialist, remained baffled. He thought that a severe inner ear infection could have destroyed her ability to hear on that side, but there was no conclusive evidence to support this. In an attempt to recover any hearing he could, the doctor prescribed very high dosages of steroids. He told Kathy that she probably wouldn't see a change, but there were rare occurrences when steroids helped. To both Kathy and her doctor's surprise, after about a week of steroids, she completely regained hearing in her right ear. It was a, quote, miracle. Kathy wonders whether she can count on a new miracle to heal her current medical issues. Okay, so looking at the questions here. What components of the nervous system are involved in physical sensation? Well, you have sensory receptors that detect what's going on all over the body, right? It could be taste, touch, sound, sight, or light, things like that. So the sensory receptors detect what's going on. It says how does sensory impulse move through the body? Well, remember, you have the receptors, and then there is the afferent pathway that carries that information to the viscero and somatosensory cortex. So we receive those signals, and it travels to the cortex of the brain, and we perceive what's going on. Number two, what components of the nervous system are involved in skeletal muscle movement? So looking at the nervous system and how it involves that. Well, again, you have the somatic motor strip or somatomotor strip in the frontal lobe. So it's a part of the cortex of your brain. It sends signals through the motor neurons that travel to your muscles, telling them to contract. What's a motor unit? A motor unit is the connection between a neuron and a muscle cell or a muscle fiber. Number three, what actions are involved, what movements are involved in the action of standing up? Well, when you stand up, your hip extends and your knee extends, right? So what muscles need to contract to do this? Well, your quads will contract to extend the knee, and then like your hamstrings and glutes will contract to extend the hip. All right. Number four. What are the different levels of organization of a muscle down to myofilaments? This is a nice review from last semester. Muscles are bundled together by epimysium, and then what you do is you bundle together fascicles. Fascicles bundle together individual muscle fibers or muscle cells, and within the muscle cell are those myofibrils made of actin and myosin, and then that creates the sarcomere. Sarcomere is the bands where actin and myosin row together, and it shortens to make muscles contract. Let's see. How are the proteins organized? Again, it's combinations of actin and myosin, and the myosin heads row and pull on actin, and that pulls the sarcomeres closer together. Number 5, starting from the release of acetylcholine by the motor neuron, what are the steps in muscle contraction? Well, if you recall, the neuron will release acetylcholine that will dock on receptors on the muscle cell or muscle fiber, and then that will cause an action potential or an electrical signal in the muscle cell. And then that sarcoplasmic reticulum, in the animations we looked at, it was like a blue membranous sac. It releases calcium ions. Calcium ions pull back on those little protein ropes covering actin, and then myosin rows and pulls on actin. 6, are Kathy's medical problems related to her sensory neurons, motor neurons, or both? Well, it's going to be both, right? She's had numbness, so that's sensory. She's had hearing loss, so that's also sensory. And then having trouble standing, that's a motor issue. So it sounds like something neurological is going on here, right? So now let's look at part 2, diagnosis and treatment. All right, Kathy realizes that she cannot wait until her appointment to receive medical care. She quickly goes to the emergency room. After a mountain of questions about Kathy's symptoms and medical history, the doctors decide to admit her for further testing. She is transferred to the neurology unit, and the doctors request she undergo a series of laboratory tests, including an MRI and a spinal tap. In the meantime, the doctors prescribe high dosages of steroids to help alleviate the symptoms. Upon reviewing Kathy's medical history and the results of the various lab tests, the neurologist diagnosed her with multiple sclerosis, or MS. They explained to Kathy that MS is an autoimmune disease and that her own immune system has been attacking the myelin sheath that surrounds the nerves of her central nervous system. She remains in the hospital for a week until sensation is fully recovered in her lower body and strength is restored in her legs. She is discharged from the hospital and schedules a follow-up appointment with the neurologist. When she returns to the neurologist, they discover Kathy's different options for treatment. Because there is no cure for the disease, options and medication vary greatly. She decides to try daily injections of Copaxone, a medication that is similar in structure to a protein found in the myelin. So that's interesting. Kathy continues to see the neurologist on a regular basis and gives herself an injection every evening. Over the course of 7 months of therapy, she only experiences one occurrence of numbness, which subsides after a couple of days. She tries to stay positive and tries to minimize the disease's impact on her life. Okay, so poor Kathy's got MS, so let's start to look at what's going on here. Number 7, what is myelin and how does it affect transmission of nerve impulses? So again, myelin is that sort of waxy or fatty coating that insulates neurons, and it speeds up the transmission of signals because the electrical signal is only generated at those nodes of Ranvier, the little gaps in myelin in the axon. Identify cells responsible for the formation of myelin. Those are the Schwann cells. Again, Schwann cells deposit that sort of waxy coating on the axons. Number 8, what are scleroses? Scleroses are basically damaged tissue. It's like scarring that occurs. And it occurs on the axons of the neurons in the nervous system. So if you look at like an MRI or anything like that, you'll see these areas light up because that's where the scarring has occurred. How does this influence nerve transmission? Well, when you destroy the myelin coating, that will impair or impede the transmission of those electrical signals. So then basically muscles don't get the signals, or if you're influencing sensory pathways, the regions of the brain that get the sensory information don't get those signals either. Number 9, how do an MRI and spinal tap help confirm the diagnosis of MS? Well, again, with the MRI, you can see the sclerids or the scleroses where you've had the damage done to the brain. And then in the spinal tap, you're looking at cerebrospinal fluid. You're looking at the fluid that bathes the nervous tissue. And what you can see are cells and proteins of the immune systems that are involved in attacking the tissue in the brain. So if certain proteins are present, that's a sign that your immune system has attacked the myelin coating of your axons. Number 11, why did steroids help alleviate Kathy's symptoms? Well, steroids do a couple of things. One is they reduce inflammation, so that can help. Additionally, steroids will impair the function of your immune system. So if your immune system isn't working as well, then that's going to slow the attack on the myelin coating of neurons. 11, how does Copaxone work as a treatment for MS? It said earlier that Copaxone has a protein similar to that found in myelin. So it's basically serving as a decoy. The immune system will attack the proteins from Copaxone rather than attacking the proteins in the myelin. So it sort of throws the immune system off the scent of the myelin to sort of slow the damage that can be done. So medications that a person can take basically impact the function of the immune system. Either you create a distracting target, or you slow down the operation of the immune system to try and prevent the damage to myelin. 12, why did Kathy experience the altered sensation in her body? Well, again, if you destroy the myelin coating, you don't get the signal, so you may not sense or feel things as you would otherwise. Was there something wrong with her skin? Probably not. Again, it's with the axons that have been attacked by the immune system. Why couldn't she stand? Well, that's because motor neurons had their myelin destroyed. So you may be sending the signals to your muscles saying, hey, stand up. But if the signal is stopped, well, then the muscles don't get the message. Was there something wrong with the muscles in her leg? No. Again, it's a wiring issue. The myelin coating was destroyed. 13, did Kathy's hearing loss have anything to do with the MS? Quite possibly, because again, you have myelin coating that will influence the transmission of signals. And plus, since using the steroid, it did help bring back her sense of hearing. So that may have been something that sort of impacted the function of the immune system. So that helps explain that. All right, so that's it on this case study. It's a nice example of how the structure of neurons really matters. And if you do something to alter that structure, you impair the function of the neurons. And then that has impact on the body's ability to detect and to act. All right, if you have any questions, let me know. Otherwise, I hope you have a great day. Thank you.